You are listening to the Money Hour on 1150 AM KKNW, the Friday 5th virtual show, still running our show virtually. You can also listen to us on podcast, catch us on air on Saturday at 3 p.m. with a rebroadcast on Sunday at 8 a.m. I am your host, Tina Mitchell.
And I'm your co-host, Keelan Harvey.
It is a great day to talk about money, and that's what the show is all about, how to make money, save money, so you can have a better quality of life for you and your family. And now in studio, we have Dr. Sierra Storm of Rise Regenerative Medicine. Are your scars preventing you from healing? Right here on 1150 AM KKNW. Sierra, welcome to the show. Very excited to have a conversation with you.
So lovely to be here. Thank you for having me.
Absolutely. A little bit about Dr. Sierra Storm. Her life work is to help you age in reverse and live, breathe, and move in body that is pain-free. After a biking injury left her arm useless, she set out to find safe, natural, and effective non-surgical solutions for complete recovery. This search led her to discover regenerative interjection therapies. Within 8 weeks of treatment, she was out of the sling on the beaches of southern France, able to carry her own luggage. She knew she needed to bring these therapies to her patients. Using these safe and non-invasive tools, she helped hundreds of patients prevent and recover completely from surgery, even if PT, chiropractic, acupuncture, there you go, massage, or previous surgeries had provided minimal relief. Hey, Keelan?
I told you, Sierra, everybody does it, including myself, the famous mute button.
Yep.
I feel like I should call you doctor. Sierra is okay? Dr. Sierra?
Dr. Sierra, Dr. Storm, Sierra, all good.
All right, sounds good. Yeah. How did you get into your line of work? Tell us about it.
Well, it kind of covered it a little bit in my bio. I had just graduated from naturopathic medical school, and I got into a crazy mountain biking accident in Colorado. And my partner at the time was about to deploy to Afghanistan, and I just did not have the support that I needed to go through a surgery and a post-surgical recovery. So I did a ton of research into natural therapies to help my arm heal. And I found what we call regenerative injection therapies. I went to see a doctor in Bellevue, and within 8 weeks, my arm was back to good. I was out of my sling and I was carrying my luggage through the south of France, which is an incredible trip. So I have been doing this for 8 years, and 3 years ago, I opened an integrative wellness clinic called the Rise Collective, where we help people heal from the inside out and live a life that feels really limitless.
And that's so beautiful. I just love it, interviewing so many people here on our show, that the best of the best, there's always a big why and how that's attached to what you do and your story that got you into your line of work. So what a beautiful story that is, for sure. So let's talk about what kind of people or conditions that you're treating.
So I say that I help people prevent and recover from surgery. So if you've had a sports injury or you have arthritis and they're telling you you are headed for surgery, you're going to need to repair that rotator cuff, Keelan, let's talk. Or you have an ACL injury to your knee and they're telling you need surgery, we can actually heal that joint from the inside out using these injection therapies without having you go through that procedure. But also what I do is I help people heal from the scar tissue that's created by a surgery if they've already had one, or if it's a last resort type of emergency surgery. So that is joint replacement surgery, C-section, hernia scars, appendectomies. They all really impact our body, and I can help people get all the way improved and healed from that point forward.
Well, Keelan, it's just, we should have had her in the show last year. When was your surgery?
It's been 1.5 years now.
I was going to say 2 years, but that seemed too long. Yes.
Yeah, long time, but still suffering.
Oh, I'm sorry to hear that. I hear that a lot in practice, truly.
That's okay. I'm going to PT, and I don't know if we just like attract this to the show, but my PT guy was talking about getting some, I don't know what kind of injection into my knee, and I leaned into naturopathy, if I said that correctly, more. So we will definitely be talking for sure.
Let's be in touch. Let's be in touch. I'd be happy to help.
So what kind of people or conditions do you treat?
Yeah, so anyone who's looking to either not have a surgery or to recover completely from surgery is fabulous fit for our practice.
So let's talk about how do scars hold people back from recovering from their pain?
Oh, this is my favorite question in the world. So, scars, we can see the top of the scar, we can see the scar on our skin surface, but we cannot see what's happening deep to that tissue. And scars have a tendency to form these little tendrils that look like spider webs that can attach down to other parts of our body and cause restrictions in that area. So that can attach, let's say you have a C-section scar, that can attach to hip tissue, to uterine tissue, to your bladder, to your colon, and it can change the way your bowels function, your urinary habits. You can change your period. It can change the way your hips move. It can give you low back pain, and it's all coming from this one scar. So scars have a tendency to make you feel like everything is going wrong within 4 weeks to 10 years after you've had that surgery. So we can actually go in and treat the scar, release those fascial adhesions, and give you your freedom back and reduce your pain instantaneously in the office. It's my favorite thing to treat in clinic.
Wow. Yeah, so I had a patella tendon ACL surgery, and I thought like it's supposed to be, and I have this, I want to, well, I'm gonna name names, Sounders doctor, so he's really good, right? So I had that done, and I thought it'd just be a quick recovery. And patella tendonitis, you're hitting it right on the head. I'm having all these issues with scar tissue in the patella itself that it's hindering me getting back to the performance level that I need to be at. So, which leads me to my next question is, why do you suggest suggestions, and then why can't people just go to a PT or a chiropractor? I mean, I think I might be an example of that, quite frankly.
Yeah, so it comes down to that scar tissue, truly. If you have these little adhesion, these bands that are connecting your outer scar to deeper tissues, we can do a lot of adjustments, we can do a lot of mobility work, but the easiest and fastest way to do this is to do what I call fluid dissections. We just blow a little bubble of fluid right under that scar, the scar that you can see, and we can cut through those tendrils and release that from the underlying fascia. All of a sudden, you get back instantaneously that mobility, you have a reduction in pain. Anything that's caused by that scar adhesion will sort of melt away. So it's just a quicker way to get to the end game. I love chiropractic and massage and acupuncture and PT. It's amazing. I work with all sorts of practitioners who do this work, and they work really complementary. But what injections can do is just bust through that plateau that's caused by the scar tissue, and then you can get back into your regimen and it just works even better.
Yeah. So, Sarah, what would you tell people that they need to know about taking over the counter pain medications?
Oh, this is such an important question. Okay, so a lot of times when you are recovering from injury or surgery, they tell you to take NSAIDs, non-steroidal anti-inflammatory drugs. This is Advil, ibuprofen, naproxen, Aleve. These tissues over the last, or these medications over the last 10 years, we've seen that they actually prevent tissue recovery because they dampen the inflammation your body needs to heal. So people will actually have to get knee replacements sooner if they rely on that medication because their soft tissue is not healing. So what I tell people is do not use these medications for long-term care. You want to use Tylenol as long as you don't have a liver and kidney issue, but stay away from the NSAIDs. They are actually worsening your pain and preventing you from healing all the way.
Wow, that makes a lot of sense, actually. Your body is a magical machine. Why would we hinder what it's trying to do to heal you? So I don't think we can do, medicine's got its place, but if we can rely on the body, I don't think it gets better than that. What about diet? That's something I've been focusing on in my healing. I decided that I just want to help inflammation, get rid of, eating like junk, eat some real healthy food that can feed and nourish my body.
Oh, I love it, Keelan. You hit it right on the head. So we think of pain as a compression pressure sensation on our nerves, but it's actually partially a chemical sensation made by these little chemical messengers called cytokines. And cytokines are released in the body when we come across an inflammatory agent. That can be a bacteria, but it could also be a food. So if we make this surge of inflammatory chemicals, I kind of call this the lemon juice effect. If you have no cuts on your arm and you pour lemon juice down your arm, you're not going to feel it. It's going to feel like water, right? But if you have a paper cut, that lemon juice is just going to light up and your arm and you're going to feel the pain. Same thing with like a damaged joint. If you're eating an inflammatory diet and you have some tissue degeneration, that inflammatory signaling is going to irritate that injury area and increase your pain 2x. So a lot of times if we can get people on their own unique anti-inflammatory diet, their pain levels will drop 50% without even having to treat. diet is critical when it comes to pain. And it's something I love to teach my patients about, for sure.
Yeah. Wow. Such great information that you're providing. I see Ariel is just shaking her head up there, and in total agreement with what you're saying. So let's talk about hormones and the impact that those have, that has on your pain levels.
Yeah, so we always want to address pain on a full body level. Your hormones actually signal your body to do tissue repair. There are some really important ones like growth hormone, estrogen, testosterone that tell your body to repair its tissues. Thyroid actually hormone as well, very, very significantly important. So if you have a hormone imbalance and it hasn't been detected, you might stall out in your recovery 50% before you actually should. You might not get there completely because your body's not getting its healing signaling. So we always test hormones, we make sure they're balanced, and then we do injection therapy to just clean up all the rest of your recovery and get you back to 100%. We have that whole body systems working together is how we get the maximal results.
I love that. You're hitting it on all angles here. So you do injections for pain. What about for cosmetics?
Yeah, so this was really exciting to learn. We do regenerative injection therapies. One of those is called PRP, or platelet-rich plasma therapy. We draw blood from your arm. We spin out these unique cells called platelets. We inject those into tissues. They secrete growth factors and they signal your body to lay down new collagen. This is amazing for healing the joint from the inside out, but it can also tighten your skin and make it glow, and it can also regrow hair. So if we like turn our body's innate healing signaling into the tissues that need it, your body just gets to work healing, and that can take the place of like Botox and fillers if you're looking for a more natural approach and you don't want to resort to those other therapies. So it's ubiquitous through the body. It just helps so much with collagen production, which is our main structural protein of the body that keeps us youthful.
Yes. Wow. So Sarah, we have 1 minute left. Would love for you to say, who should reach out to you and when should they be reaching out to you, when they're start experiencing pain or before?
Yes, anyone who is in pain should reach out. Anyone who's considering surgery but would rather not have it. Anyone who's had a surgery but feels like they have not completely recovered. Those are all fabulous fits for our clinic. And I would say reach out as soon as you're in pain. The moment after you get a sprained ankle, we can treat you with injections. 4 to 8 weeks after your surgery, we can treat that scar and make sure it heals really well. So reach out as soon as possible. I offer complimentary visits. So you can just get me on the phone for 15 minutes and we can talk about your history. And I will tell you what the right injections would be and if you're a good fit for this medicine.
Wonderful. Dr. Sierra, thank you so much for joining us on our virtual show.
Thank you so much for having me. This was so fun. Nice to be here with you all.